Good afternoon, viewers out in Facebook and YouTube land. So happy to have you here today. I am going to be interviewing Gloria Mathiesen, and we're going to be talking about mental health and how we as massage therapists can support our clients who are working through mental health issues, and how to most importantly maintain our within our scope of practice and our ethical boundaries within providing those services for our clients. And so I'm going to let her introduce herself and her expertise and how she is our authority on this conversation today, because she has a great background, not just in body work, but in mental health therapy as well. So I'm going to bring her in. Hello, Gloria. Welcome. Thanks for coming on.
Thank you for having me today, Michelle. I really appreciate it.
Of course. And I was enjoying our pre-interview chat, and I was like, oh no, we got to go live. And I was like, okay, we'll talk. We'll continue the conversation in a minute, because I was really enjoying talking to you about this. And I just think we were talking about the way of the world the last couple of years particularly, and it just seems there's like so much heightened anxiety, and whether or not it's a diagnosed anxiety that is going on, but just everything's seeming on edge lately. So I'm really looking forward to having this conversation with you. But before we dive into that, can you share a little bit about yourself and how you got into body work, and how also you're do everything else that you do in the mental health capacity as well? I'll let you tell us a little bit about that.
Yeah, well, thank you. So as far as massage and mental health or counseling, I've been a client of both in my lifetime. And I really believe in the process, the therapeutic process that they both offer as an art. I really consider it as an art. And I remember one of my first massages, I was on vacation, and we found her in the yellow pages. You might be too young.
No,
remember the yellow pages.
Mm-hmm.
But we went to her house, and I was like, this is so cool. I want to do this. And massage has just helped me throughout the years for a whole bunch of different things. And then when I was in grad school for mental health counseling, I put myself into therapy just because I felt like, if you're going to do something, you should experience it. And it was a good time for me to do my own personal work before taking on somebody else's. And it was a great experience. And so I truly believe in the process. And I'm really trying to be a strong advocate to get rid of that stigma, that for both, because even in 2022, there's still the thought of or association of body work with human trafficking, and then with counseling, that it can be a weakness or something that to be shameful of. So the more we talk about it, and that's why I'm really glad we're talking about it today, because I think we need to talk about it, especially now.
Right, absolutely. So what was the timeline of like when were you into mental health first or massage, or was it around the same time for you?
So initially I got my undergrad in psychology from University of Michigan. I'm from Michigan, and it was a long time ago. But essentially, all you could really do with a bachelor's in psych is like case management. And so that was really my first exposure of working within the mental health field. And I worked primarily with children who had were taken out of the biological homes because of abuse or neglect. And I worked with them in that interim before we were able to place them for adoption. And it wasn't really the happiest of jobs.
Yeah, that's really hard.
It was great experience, and I was learning stuff that wasn't covered in the textbooks. There's nothing like hands-on exposure. And then, so I guess that came first. And then the massage, which technically I've been doing for over 25 years now, that just kind of came into something as a means to have an option from the case management. because I had been
Yeah.
receiving massage and really enjoying it. And then I started
Mm.
to research, like, what do you have to do to become a massage therapist? And
Yeah.
it was, I went to Irene's Myomassology Institute in Farmington Hills. Great experience. And actually, the whole education process really changed my life. I mean, it really brought more body awareness for me, because we're
Yeah.
practice on each other, and
Mhm.
just introduced to like aromatherapy and macrobiology, and just all these acupuncture, all these other new CAM things that I hadn't really been exposed to.
Right.
And it was a very positive experience and process. So, and then grad work, and then I got my
Mhm.
license, and now I'm primarily my primary job is a mental health counselor, and I specialize in trauma. So,
Okay.
and right now, 100% of my clients are trauma based.
Okay.
Yeah.
Okay. I was going to say awesome, but that just sounds like terrible. So, I mean, great
Well,
your background. Thank you for sharing the background. Probably more appropriate for saying that. So, what did you have an aha moment when you were like, body, mind, I need to help people to connect this more and explain things to them? And what
yeah.
was that process for you?
Yeah, absolutely. Well, one of the things that I think it's important to remember, trauma, for example, is it's literally impossible to go through the integrative and recovery process of trauma without the body, without some kind of self-awareness of the body. And a lot of times, because of history of trauma, the body has actually become something too scary to reside in. It's
Mhm.
become the enemy. And
Mhm.
so I think it's also important to mention that because of the science that we have today, the neuropsychology and the access to the brain, and a lot of the advanced trainings that I'm participating in today for my own practice weren't even available when I was in grad school. We didn't, like, trauma wasn't even really discussed, believe it or not,
Mhm.
in grad school.
Mhm.
And but today it's like it's the thing, because we're really we have so much more awareness today of how trauma really is the origin of so many co-occurring disorders. And it's pretty prolific. And I think
Mhm.
it's really important to understand and look at the client holistically, that we're dealing with the mind, body, and spirit of this individual. And a lot of times it's all fragmented because of the traumatic experience. And
Right.
so, yeah, there was a lot of aha moments. And I think because I had that base in massage therapy,
Mhm.
really makes me a better counselor, because
Mhm.
I I understand how the body can respond and react in certain situations if it's activated or hijacked, or so
Right.
it's really it's an incredible journey. Yeah.
Yeah. Absolutely. So when did you first teach a first class on something mental health? I was talking to you before that I've taken one of your classes on working with people with PTSD. Was that the first class that you developed for body workers?
Yeah. So the reason why I started, because I've been teaching since 2007, and initially I was a adjunct instructor at Pima Community College.
Mhm.
I actually helped design their massage program, and taught there for a few years. And then I became a provider with NCBTMB. And I wanted to start taking some classes myself about body work and anxiety and PTSD and whatnot, but there really
Mhm.
wasn't anything available.
Mhm.
And at the time when my interest in PTSD really grew, I was living in El Paso, Texas, which is where I am right now.
Mhm.
Um, and we have Fort Bliss here. And I was working with not only military, but their extended families. And I was just noticing the PTSD and the anxiety that can really affect the entire nuclear family.
Yeah.
And I always felt fortunate because of my background and training. I understood PTSD and how to handle situations like if there was a panic attack or flashback or something like that.
Mm-hmm.
But there was this gap or void within our continuing education realm that didn't really offer those courses to help massage therapists feel more confident and comfortable with working with situations like that. And so that's essentially why I started to develop the courses, because I felt like there was a need and I just wanted to be a part of that process to fill that. But yeah, PTSD was the first class with mental health, and it just exploded, which just kind of affirmed that I might have been onto something, that there was definitely an interest, that people wanted to know.
Yeah, that was it. It was great. And I when I was telling you, I was a volunteer with the AMTA when you came in and taught the class for us. And I used to just take all the classes we offered because I was able to. And so I, just walked into it kind of like, oh, it's another class. I love learning, whatever. And I felt like I was just doing this the whole time, like, wow. And it part of that was too, because I think I had a certain perception of what PTSD was, and just what like I didn't personally, or I don't know if I know someone personally who has been diagnosed with it, but more of a generalized thing you see on TV and in movies and shows, and what you hear from other people and things, and what you think it is. And I just remember being like learning so much about what the actual condition is and changing around like what that means for what my perception was, and that there's so many pieces of it, and it can manifest in many different ways, and just knowing that, just learning about that was elevated how I could approach if there's an issue, or if somebody came into my practice with it. And not so much like if the person comes in with this, do this, but more so just this basic understanding to be able to approach that client in a different way. And that I loved how you used the word holistically as well. So it was really, really fascinating for me to take that class from it. And I'd tell people, I was like, I just can't explain. You just have to take it, and really you'll understand it so much better. And it also just helped me approach other people as well, the same with different, slightly different approach, I guess, too. And that I can't always just put everyone in a box of what I think it's going to be as well. So, and I realized that I was like, oh, I think that would explain this about this person I know. And like that, like there's so many aspects of it, and to learn that, and for you to break it down for someone who's not trained in mental health, I think was really, really, really amazing for you to do that. And so I'm really glad you have this class, and I can see why it's popular and why people jump into it. But that reminds me too that I saw you had posted about it recently in Facebook, and that's when we started our conversation to come onto the live stream. And someone asked, "Well, are you going to teach different techniques to how to work with someone who has PTSD?" I think that was the question that they asked. Wow. And so, can you address that a little bit of like what your class does and doesn't have as far as like the techniques part goes with that?
Yeah, sure. So PTSD would fall under lecture course. So it's primary lecture, so there's no hands-on instruction or anything like that. But what I do provide using the PTSD class as an example are the modalities that are backed up by evidence-based research as being proven effective with clients who've been diagnosed with PTSD. And so, for example, craniosacral is one a really good modality to use with PTSD and trauma, primarily because we're not diving right into the body right away. We're just kind of getting accustomed with a client, that we're building trust and rapport. But I think, and this is something I say in all of my classes, one of the things to remember, because all my courses are research-based, and when you look at the research provided out there, they're primarily using Swedish massage. And that's because it's measurable and it's something that we all know. We've all been introduced to effleurage, petrissage, tapotement,
Right.
stuff, and so we all know what that means because of that core base that we were taught in massage school, and so it's just easier to use, I think, when they're doing these studies, unless they specify something like cranial or Reiki or something like that. But, it's not so much like, again, using PTSD as an example, it's not so much the technique, it's the kind of space that you're creating for this client. That whole therapeutic process and experience is part of their recovery. And it's something just as simple as them using the word no can be huge in their recovery process, or I only want this, or don't touch this. That's going to be just as effective and as important as whatever you're doing on their back. So it's kind of important to keep that in mind, that it's just so valuable, and it's something I can't do as a mental health practitioner. I don't touch my clients,
right?
So it's just as an adjunct. And again, research supports that recovery is more efficient and easier when you're combining both the body work and the counseling.
Yeah, that's really beautiful. And to have a massage therapist who is informed on the different mental health conditions is great for a mental health practitioner, a therapist, to be able to have that kind of coinciding referral base and be able to work with them as well as part of the healthcare teams. And maybe you can't share this or not, but are there massage therapists out there where you guys are sharing notes with each other about a patient, or is that something that's out there for practitioners who might think about doing that? Like, I'm thinking if I work with a chiropractor, we're oftentimes sharing notes, but
like a team, like
yeah.
I think, confidentiality and HIPAA and all that is, of course, has to be the number one priority.
Right.
But I have, like, for example, for my, as a mental health practitioner, I have a supervisor and a supervision group that I can go to for debriefing or kind of share notes. And, and we identify clients by initials. So, it's the confidentiality is secured, but we're sharing stories and experiences. And especially when you work primarily with trauma, it's really important to have that outlet, because we are susceptible to secondary trauma or compassion fatigue.
Yeah.
And so I really make a conscious effort of taking care of my own mental health, having that support. And but yeah, I don't see why massage therapists couldn't, whether it's locally or nationally or within a company or a school. I think it's important that we can get that feedback and exchange, because it's an opportunity for growth.
Yeah. At the very least, some cross referrals and things like that probably is really, really great.
Absolutely.
Yeah. Absolutely. So you had mentioned a couple statements earlier. You're talking about holding space, and then in what you just said, you were talking about compassion fatigue. And so it reminded me of things about kind of, and this is probably a long answer that would come out of it, but it's kind of going from how do we hold space for our clients with any kind of condition, really, because it's not just in the mental health field, in a way that is not only safe and within our scope for both the practitioner and the client. And also, how do we do that either without getting into that compassion fatigue kind of realm, or knowing when it's going to have, or recognizing the signs, or because I feel like we can set out to really have great intentions for things, and we're going to hold all the space and help the client through all this, but we have to be careful of like how much we're doing and what parameters we're doing that in, not only for our scope but also for our own well-being as well. So what advice do you have for therapists, massage therapists out there for that?
Yeah, sure. Yeah, I think scope, I actually developed and taught ethics
Mhm.
at Pima Community College. So this is a big thing for me. And I'm assuming most massage therapists know this, but you can actually get a detailed script of what your scope of practice is from your licensing board website. And I would start there first, because
Mhm.
also your liability insurance, it's you want to understand what's covered by your liability insurance and stay in that realm.
Mhm.
But I think in regards to mental health, I think it's important to know before you even go in that door, before you even open that treatment door, that you're not treating the diagnosis itself.
Mhm.
You're not treating PTSD. What you're treating are the physical manifestations of. And so that's the easiest way, I think, and that's how I present it in
Mhm.
my classes, that, we all know what to do with muscle tension. We all know what to do with chronic pain. Usually, we all know what to do with
Mhm.
headaches. We
Mhm.
know how to support insomnia. We know how to support GI, gastrointestinal issues. We all know
Mhm.
how to uh, increase deep breath, and all these little things that we already know how to do are
Mhm.
very applicable to these physical manifestations that you're going to have with anxiety, PTSD, trauma, by whatever it is, depression. um,
Right.
and by keeping our focus on that, it's going to keep you pretty safe.
Mhm.
What we want to avoid are the stories. We want to avoid the trauma stories. Um, and sometimes clients, as you know, they just start talking,
Mhm.
and depending on what part of the body that you're working on may actually activate or trigger a memory. And
Mhm.
so, what I often suggest is if you notice the client starting to get agitated or whatever, move, move to
Mhm.
a different part of the
Mhm.
body, um, and have them take a few deep breaths. We want to intercept that, because we don't want it to become about the trauma. We don't want it to become about the diagnosis. Um,
Yeah.
so that also requires the massage therapist to stay in tuned, to really stay in tune. We don't want to be checking off a grocery list. I've had so many massages in my life. I've lost count, and I've had
Mhm.
some really bad massages,
Yeah.
where I know they weren't present, where they weren't connected,
Mhm.
and
Yeah.
that's when we become vulnerable as a massage therapist. And
Mhm.
so if you're checking out, if you're starting to feel burnt out, or um, not wanting to go to work, or just not caring,
Mhm.
these are little signs that we may want to kind of regroup, and excuse me, we might be experiencing some compassion fatigue or secondary
Mhm.
trauma, especially if you yourself have a history of trauma or have your own stuff going on. Um,
Right.
it might be a time where you might have to seek out some help or support, through a
Mhm.
licensed practitioner, or your church, or wherever it is that you can get your support from.
Right. Okay. So what happens then for a therapist? You said one great example and tip is if you notice a client is getting agitated in the area, maybe move on to another area and take a deep breath. What if there's an emotional release that happens? What are some of those, or if that client doesn't stop talking about the stories that they wanting to talk about,
Mhm.
what some advice that a therapist could do in those situations?
Yeah, that's a great question. And my thought is always prevention.
Mhm.
If we can prevent situations like this. And one of the best preventative measures we have as massage therapists is that intake and assessment.
Mhm.
And it's critical, especially when working with mental health. One of the things that I provide in my classes, I call it a mental health status. And this is new since you've had my class. So
Uh-huh.
I can
Yeah,
send
I'm excited to take it for the whole class soon. So I'm all for it. I'm all
Yeah.
ears.
So this is essentially a template that excuse me, any massage therapist can add to their intake forms. And it's very specific about particular diagnostics and then the accompanied symptoms. And so right away, we're starting that open, honest dialogue and normalizing these things, normalizing panic attacks and normalizing flashbacks and normalizing whatever it is that they're experiencing. And when we start to have this communication with our clients before treatment, we're building it. We're building trust. We're not working with this power differential that will occur within the treatment room. It's just you and the client one-on-one equally. And we also want to inquire it, like, for example, say they have panic attacks. That's something I want to know
right
before going in the room, right? And so if that box is checked off, I want to know what they do. I want to know, what does it look like? What tools do you use? What can we bring into the room that's handy in case something does occur? And so as we communicate and talk about these things, it starts to diffuse the intensity and the fear. And by normalizing it, it just becomes another conversation about if it's chronic pain or, whatever patients are coming to you for. But the client, if we give the client an opportunity to share what they already know, that's going to be so helpful down the road instead of guessing. But yeah, if another thing, particularly with mental health, we want to have some flexibility. Because I'm thinking one of my clients I've had in the past as a massage therapist, I had a client who had suffered extreme sexual abuse. And when she came to me, she was in therapy. But for 3 months, I was at her feet. And that's all that she could tolerate. And it was just this process that we had to build with trust and everything. So the point of that is it's not going to be a cookie cutter massage. It's every client's going to be different. Every client's needs are going to be different. Positioning on the table, they might not be able to be face down. Because that's activating. And so we want to be flexible. We want to, they may only be able to do 15 or 30 minutes to start, and so, but it's these conversations that we have before are going to be so valuable to you as a massage therapist and really prevent any situations that might get out of control or to where you don't feel comfortable or confident enough. And you mentioned emotional release. Hand them the tissue box. That's all we have to do. And it's like situations like that. And we might even talk about emotional releases before the treatment room. The client might say, sometimes I get really sad. Okay, we've got some Kleenex in the room for you. And so again, just kind of normalizing and diffusing these symptoms and effects that come with these disorders can really help both you and the client have a really therapeutic and enjoyable hour.
That's I was just thinking too about the oversharers, I like to call them too. With I know a few therapists are like, we're almost like bartenders. People want to talk to us about all their life problem and want to ask for our advice and things. And even with someone without a severe condition or something diagnosed, even just the little things are like, well, my husband this or my best friend that, and so it runs from that little small thing that might seem like insignificant and no big deal, to the point of like, oh, I've suffered this major traumatic event in my life. What do I do? And to not even get to that point of that part of the conversation. I think that's a struggle for many therapists. How do I cut off my client without being rude or allowing them to get things off their chest that seem to be helping them? I know that's approach because I don't think any therapists, maybe not, I don't know. I don't think there's many therapists out there like, I'm going to fix this client's problem and I'm trying to get that, but they just don't know how to navigate it when they're in that situation. And how do you tiptoe, or how do you flat out say this is the boundary and that's it? And I know we've talked about preventative, starting to set the stage from the beginning, but even with all the right measures, I think there's still that risk that once we enter the space,
Yeah.
all the bets out the window there. So do you have recommendations for that?
Yeah, absolutely. Yeah. So if we've got someone who really starts to become chatty, and just kind of flooding you with information that is really becoming distracting, I think. I think that might be a time where we can kind of hit the pause button. We might have to redrape the client and just kind of step a little bit away from the table and say, I understand that there's these things that you want to talk about, but my primary focus needs to be on your body, and what I'm doing here. And would it be okay if we took 10 minutes, of just a little bit of quiet time to where I can work in this area? Or is there a different area that you would rather be me focus on? Because again, that chattiness might be discomfort from where we're working. But if we're doing, like, if we're moving to a different area, if we're having them taking deep breaths and all this stuff isn't working, then that's something that's going to have to be addressed. And it might even have to wait till after the session, because we have to really be careful during the massage and have that awareness of that power differential.
Right.
Because, we're up here and they're down there naked.
Yeah.
And our tone, what we say, it can really be received in different ways. And so it might even be something that we have to kind of wait out, kind of endure, but then once they get dressed, you hand them the water and you sit down, then maybe that would be an easier time to say, hey, I noticed that you had a lot to say today, and that's great. But maybe we can, our next session, we can cover it all the first 10 minutes. And then we can just kind of focus on relaxing and breathing. And I can really focus on working in these areas of your body. That might even be.
Yeah, I love that. And I know I've given some advice to students before, especially if they have a repeat client. So the next time they come in, then this is when you say, when you're talking to them and getting on the table, and before they get on the table, say, I want to really focus on tuning into your body this session. And I know last session we were chatting a little bit and getting to know each other a little, but in order for me to give you the best massage I possibly can, I think it'd be really helpful if you just focus on your breathing and just let me know, of course, if things are uncomfortable, and I'll check in how you feel. But to try to make it about the session or something like that is really helpful. Or if you just know, like, I don't want clients talking to me, set that stage right at the beginning. Then this is how, on top of these are where I'm going to work, this is also how I like to have this session, and make it more about the stillness and the quiet and things like that too, to try to help them, because it's tough.
Yeah. Well, one of the things I used to always say to every client right off the bat when they were new is, I would say, I don't talk unless you have a question, because there's a lot of therapists out there who are chattier than the clients. That's a whole nother
right. Yeah,
it's a whole nother issue
too.
yeah. But I let them know ahead of time that you're welcome to tell me if something needs to change or the direction. But I'm going to be quiet today, and my focus is going to be on our goals. And but if you need the reason to say something, I'm open to hear it. It almost gives them permission to be silent. But I think we also have to remember too that some people are very uncomfortable with silence. And one of the things I have done in the past that it actually kind of helped that is I've invited clients to bring their own music. And then it's like something that they've associated with stillness or meditation or whatever. and that can actually quiet them down to some
Yeah.
extent because it's something familiar. But
Yeah,
yeah,
that's
it's tough.
yeah. I know it's hard. You have to constantly keep checking in. And I like the music idea though too. And I tell my students back in my day when people are bringing their own CDs, now they can just stream.
Yeah,
What do you want to listen to? Let's listen to this
right.
station. Yeah. So it makes it a lot easier this time around for people. Yeah. The worst, one of the hardest massage I've had one time was a musician who could not have music on and he didn't want to talk or anything because he would immediately go into music. I
Yeah.
think he was a musician for an orchestra or
Oh,
something. Like that was his job. So he's
yeah.
like, I can't listen to music because all I'd be thinking about is the counts and the this and the
Yeah.
that. And like a whole hour of no, like I could hear my breathing. And it was really, really hard. So I'm like, oh,
Flowering.
like, oh, because I don't mind not talking. Most of my sessions are complete except for turnover and sessions over. That's all pretty much I've talked the whole session. But yeah, complete silence was, wow, that was tough. That was really, really tough.
Yeah. I've even said something, diplomatically, beforehand that, talking can be very distractive for me and losing my focus on what our intentions are today. Because it can be,
Yeah.
So yeah, that's a tricky thing. And working with mental illness, and particularly trauma, one of the things to remember too is stillness and quietness can actually be triggering.
Yeah. Yeah.
Because can actually trigger anxiety. Because what do they say? Within the first 10, 15 minutes of massage, we're activating that parasympathetic, right? And so they're starting to go into that rest and digest mode and everything's quieting and getting still. And that can actually feel very unsafe for those with a history of trauma or anxiety. And so if that's the case, we just need to shorten the massage and actually build that tolerance to be neutral, which is one of the biggest things we do as trauma therapists is we have to build that resilience in order to even integrate. So that's an excellent way of how massage can really help that process of building resilience. But it can also be very uncomfortable at first.
Yeah.
Because when we're all my counseling clients, not all of them, but a lot of them, nighttime is the hardest time because there's no distraction. It's quiet, it's still, and they're just left there with their thoughts in their body. So it's just something to be mindful of.
Yeah, absolutely. And again, back to our note, one size does not fit all, and you have to know there's multi dimensions, and everyone's individual. Even if they have the same diagnosis, it's not one size fits all. So what if I'm a new therapist coming into the field? I'm like, well, I'm just not going to get into this, and I'm just working on their muscles, and that's all I need to worry about. How am I going to do well in the field if I take on that kind of attitude? I'm not going to worry about people's mental health. There's not that many people that are going to come to me for things that have this, and everything and beyond. Why do we need to know about this?
Yeah, I'm glad you're asking that actually. And you were kind enough to kind of give me a heads up on some of these questions. So I kind of came prepared with this one. I did a little research and got some statistics. And the source is NIMH, which is the National Institute of Mental Health. And this was a report. They do annual reports, and this was a 2020 report. And we're expecting the new one pretty soon, I guess. And the numbers we're also thinking are actually going to be higher than what I'm about to share because of the pandemic and everything that's been going on. But the most recent report was that about 52.9 million American adults had reported suffering from some type of mental illness. These are conditions from depression, anxiety, bipolar, trauma. And trauma is actually at the top of the list for most common mental health condition reported. And trauma is also primarily the cause, the origin of these co-occurring disorders. So we're talking about nearly 1 in 5 adults. That's 1 in 5 adults, Americans, have reported some kind of distress through mental illness. And this doesn't even include the kids or the people who don't report. There's a lot of people who suffer in silence.
Yeah.
So to that massage therapist who doesn't think any of this is important, if you have an average of 5 clients a day, chances are one of them is going to have something going on with their mental health. And if not now, definitely at some point in your career. And what are you going to do if something happens during the session where they become hijacked or activated because of a mobilization movement, or because of the tone of your voice, or because of a smell, or because of a positioning on the table, or because of a touch in a certain area of the body? I mean, I could go on and on, because we want to remember that the body codes, or excuse me, the brain codes trauma through our 5 senses. And one of those senses is touch.
Yeah.
And so if we're not well informed, at least, or have some kind of idea of mental health issues, then chances are you might get in a really sticky situation.
Yeah.
1 in 5 is pretty. Yeah. When I read that, I was like, whew. Because we average, 5, 6 a day. I mean, that's what I used to do.
Yeah. Pretty full-time clientele. Yeah, absolutely. And you mentioned too, the people who aren't even reporting or have been diagnosed and such, which leads me to, I feel like the last couple of years we've collectively we're in it together. So it's like we're kind of like can understand it together. But I'm not a mental health expert, of course, and I might be oversimplifying, but I feel like we've been in our own little trauma bubble of the last couple of years, and like maybe micro traumas. I don't know even how to describe it, that just keep escalating. Like we're making it through, we're doing our daily things, but there's still all this stuff right here that's just compounding everything. And I thought about this recently, like with COVID in particular, like any step you take in your life with anything, there's got to be a COVID component of like, okay, I got to make sure I have the mask, or make sure who's going to have which rules, and how I navigate that, and who I can talk to and who I can't. And I just want to go to the grocery store and get my food, and so it impacts so many parts of our lives that it's just second nature at this point. But I feel like we're all kind of surviving because we have to. Right. So maybe why you're saying that number that you're saying that was reporting is going to look much higher is because all of that is compounding now for all of us.
There's also a delay too, with the brain, with trauma. We can have a delay of months, years, and that's essentially because the client never gets out of fight or flight. Yeah. And we're kind of coming out of the pandemic. I mean, I'm not really sure what's going on right now. There's still uncertainty. Right. And it's that uncertainty, that sense of entrapment or helplessness that's required for trauma to occur. And so honestly, I think collectively, like you said, as a world, we've all experienced some level of trauma or discomfort from this experience. And if it's even not fear of COVID itself, you may have had experienced loss from, loved ones dying or being sick and having a loss of health and vitality. And then, now we have the Ukraine and the Russian situation going on, which is also causing a lot of so it's just this ongoing
unstableness and like it's the unsure, unknowing.
That as a nation we've been experiencing, and globally, of course. So, and massage therapy can be such a healthy asset to have in part of your lifestyle to really help self-regulate and to strengthen our tolerance and resilience. But to kind of dismiss mental health, and I'm going kind of back to what you were saying, to kind of just dismiss it like, oh, it doesn't matter, I'm just rubbing bodies. Sorry.
It's pretty much anybody on your table is suffering from something that can be helped with with massage. And that's one thing we kept saying to, when COVID first hit and a lot of schools like, what's going to happen? What's going to happen to us? Because we're, don't touch people,
Right.
don't be in 6 feet,
Right.
within 6 feet. And here we are. Here, come to school and learn how to be within 6 feet of each other and touch each other. There wasn't really a drop for us. And I didn't see that for other people either as much when talking to other school. I'm sure there's some ebb and flow and things like that. But overall, people are like, we've got to get out there. We've got to get our touch on and get people
Yeah.
back and get them healthy. And because I think people are really feeling that void, the feeling that what it felt like to not have that touch,
Right.
and seeing like how important our job is now more than ever to bring that back in for people, but knowing that we're coming out a little apprehensive of our little holes and not quite sure. That uncertainty, again, that feeling of uncertainty to me feels probably harder than a lot of other feelings, because it'd be one thing if you know something's challenging that's coming up, but if you don't know when is this stopping or how far are we going, it's just constant on edge. And I think everyone's going to see that on the table. It's going to be manifest in our clients.
Oh yeah. Yeah. And I think, because I've talked to a lot of, I have a lot of colleagues and friends who are in the mental health field, and we're all seeing an increase in our clientele. We all have wait lists, because we're just getting kind of inundated right now with emotional manifestations, symptoms, people who were doing okay and now they need to come back, kind of a tune up, but I think probably we're all kind of guesstimating that probably within the next 2 to 5 years, we're definitely going to see those numbers rise, because as we get farther and farther away from COVID being a thing, those nervous systems are going to start to kind of relax. And then that's when the trauma usually really kicks in, and the PTSD, because there's this perception of, okay, I'm safe now, but now I have to process what I just went through in the last years, and so I'm seeing that with, essential workers, medical, educational. I mean, it was, if you think about COVID, it's kind of like we've been to war, collectively in our own kind. We've kind of been at war with this, and none of us had resources unless you were over 100 years old. This was our first rodeo.
We were all in it. I remember people saying, well, just tell us what we're supposed to do. And like, nobody knows. We're all trying to figure it out.
Right. Yeah. We had to adapt, and the ability to adapt is based on our resilience. And so those who didn't have that resilience really available really suffered, really struggled during this. So I think the next few years are going to be kind of rough.
Which is why we're more important than ever to help with that, because there is if you can back me up with it, there is research out there, right, that we're helping with mental health. And so it's more than just the body. We have to, maybe we're not treating the whole body as far as treating mental health, if you will, but we are affecting the whole body and mind in the work that we're doing. I
think absolutely. I think like, trauma, like a trauma massage, for example, and I don't even like that, trauma massage. It's but like the protocol is going to just be so different than your typical, and it's really important that we have that awareness and flexibility, and just a little bit of compassion is going to go a long way.
Just being understanding and flexible. I love that you said that earlier. And we had a comment from someone who's watching us on YouTube, so I wanted to pop that up there. That Christina says that they're starting a program at our university student counseling center that will be an integrated practice between mental health and LMT services in-house. I think that's wonderful. That's really, really great. Because treating a whole body and treating that holistically. Absolutely.
That's awesome.
I hope more places follow suit and to
do
have
too.
that. Yeah.
I do too, because I think in this modern day, it goes back to our knowledge has
Mhm.
just expanded so much
Yeah.
around mental health. And so I think the massage industry also needs to expand and adapt to this new awareness. So it's kind of exciting,
Yeah.
really,
Yeah.
the growth and um, but as a combo, you can't beat it.
Right. No, absolutely not. But you're talking about the growth and our education, so that's a good segue. So tell us about the offerings that you have and what can we learn
Mm.
taking your classes. So I'm going to go ahead and put your
Oh,
website up there that people
okay.
can find out how
Thank
to
you.
register for your classes and everything. You did mention that they're via Zoom right now. Is that
Mhm.
correct? Okay. So what do you take it away?
Well, yeah. So I'm thinking of springtime. I actually have over 35 classes developed. Um, but right now, my primary focus is to kind of reflect also what's going on in the world
Mhm.
is mental health. And so currently, I'm kind of recycling my PTSD, my trauma informed, my depression, anxiety, my grief. Those seem to be the four that are really highest in demand right now because there's a lot
Mhm.
of grief and loss as well, which we haven't even touched on.
Yeah.
Um, but those courses, um, my number one goal is that when students complete any of these mental health courses, is that they have this new um, comprehensive understanding and confidence in moving forward with working with this. I think of them as a special population, really.
Right.
I mean, I remember us talking about that in my
Mhm.
massage school days. And when we look at mental health disorders, it really is a special population, and meaning that we need to accommodate their needs. That
Mhm.
they're not going to fit in this box, as you said.
Yeah.
Um, and so I really make a conscious effort to uh, really give them the origin, the criterion, the symptoms, the manifestations, the um, just everything and anything that they can utilize
Mhm.
within that treatment to really fully understand what their client is struggling with or dealing with. And then the next part is essentially how does that translate on the table, and how does it translate into your treatment plan? Um,
Mhm.
and then from there, I really offer additional tools and things that we can use to offer, like that template that mental health
Yeah.
status was talking about, can really be critical for situations like this, because again, it's all about that is intake and assessment.
Mhm.
It's really going to make or break whether that therapeutic process is going to happen, or if we get into a situation that is not intentionally, but
Mhm.
one of the things that I think is important to remember is we can re-traumatize, we can reactivate, and we can re-traumatize a client, not intentionally, of course,
Mhm.
but there's a risk for that. And so we really want to understand how to prevent that,
Yeah.
and things that we can do to maintain that sense of safety and security.
Yeah. I love that. So you have the listing on your website. I know also you're pretty active on Facebook if people are checking out when you're adding new class times.
Mhm.
And you did mention you're going to be teaching for the AMTA chapter in April. Is that correct?
Yeah, I'll be in let me get my little schedule here. I will be in Phoenix. It's April 30th,
Okay.
and I'll be teaching the trauma informed massage therapist course.
Nice.
Um, but I'm also teaching that independently. Most of that'll be live. The one in
Okay.
Phoenix, I'm actually going to be there physically. Um, most of my courses right now have been virtual through Zoom.
Mhm. Mhm.
But I am going to start doing some hybrid courses because I think people are starting to feel more comfortable.
Mhm.
But one of the benefits that I think I've gotten from this experience with COVID is becoming virtual.
Yeah.
It's kind of opened up uh, my counseling practice and my teaching practice. And a lot of all my classes currently, I mean, I'm working with people from all over the country. And actually, I just taught PTSD, and I had a woman from Germany
Oh,
class with us. So it just kind of opens up the world, and I get so excited, when I get in there.
I always talk about the positive effects of COVID too, and that is one of them.
Right.
And our 4 campuses here in Arizona, we've connected better, and I know more of the students now, and it's been really great in those respects. I obviously didn't want something like this to happen to make it happen, but it opened our minds, because I feel like 3 years ago there were pretty much 99% of the industry was saying you could never teach any part of massage therapy virtually.
Yeah.
So just to see what we can and can't. And it's been really, really helpful. Yeah, I love that. Well, I'm looking forward to, I'm going to put, when we finish, I'm going to look at my calendar and make sure I have those dates open for myself, and hopefully be able to see you in person on the 30th.
Yeah, good to see you, Michelle.
Yeah, it would be really, really great. So I want to be respectful of your time as well. We could talk about this for forever, but I think everyone needs to just get more awareness and get into your classes, and if they can't make your classes, definitely at least try to be more open to understanding more about mental health conditions and how they affect the body as well. I know there's a lot of great books out there and stuff that talk about that as well. So I always end our chats with our little hot seat questions. So I'm gonna rapid fire them. Well, I won't rapid fire them, but I wanted to ask these as we can find out a little bit more about you.
Okay.
So Gloria, which talent or superpower would you most like to have?
Superpower. I think strength.
Okay.
I don't think you can ever be too strong. It'd be kind of cool to lift a car.
Yeah. Yeah, that'd be really cool. If you weren't in the fields that you're in, so massage therapy, mental health, is there any other career? What would you think you might be doing if it's another occupation?
Since I was a little girl, I've always wanted to be a dolphin trainer for SeaWorld.
Oh, I love that.
Ironically, it requires a bachelor in psych.
Oh,
so
you're halfway there.
Yeah, halfway there. So if I ever want to retire from all this,
there you go. Become a dolphin trainer. I love it. If money and circumstances were not issues, where would you most like to live in the world?
I think off Lake Michigan.
Okay.
Honestly, right now it's just not doable because I'd be so far from family and stuff. But I'm from Michigan. I Ludington in particular. I don't know if anybody. Just a beautiful beach town, and I love the water. And I'm in the desert.
Yeah. I know. I feel the same way, but we're kind of close to get to it if we need to. What is your most treasured possession?
Oh, my son. Yeah, my son Shane. Hi, Shane.
Do you get to see him often?
Yeah, so I have a home here in El Paso, and then he's in our home in Tucson. He's a freshman at University of Arizona, and so I bother him about excuse me, 1 weekend a month or so, because I teach out there too. So, I kind of bug him and buy him groceries, and
I'm sure he loves that. That's some of my favorite parts. Tell him to come to our campus in Tucson and get a massage.
I will.
Yeah.
He loves. He's been getting a massage since he was a baby. So
we'd love to treat him there.
Yeah.
And then last but not least, what would you tell your 18-year-old self?
18. Knowing what I know today about teenagers, I think I would tell her I was proud of her and to save money. Put some money aside, girl, because it would have been nice. But just that, she's got an incredible journey ahead and just so much to be grateful for, I think.
I love it.
Yeah.
Yeah. Oh, that's so great. Oh, I truly have enjoyed this. Hour has flown by. I couldn't believe when I looked at the clock. I'm
No.
like, oh my gosh, I have to wrap this up. I can't believe it. I could still
No.
keep going on and on. So, thank you so much for having this dialogue with me. And I know
Oh,
my
thank
student,
you so much for
particularly
having
our students, are going to get a lot out of it. But we've had a lot of people watching live, and they can catch us on YouTube and Facebook later. So,
Yeah.
um, thank you so much for this, and I hope you
You,
have a great
Michelle.
weekend. And everyone out there, thank you for watching.
Thank you.
And we will see you next time on the live stream. Bye,
All right.
everybody.
Thanks, Michelle.
Thanks.
Bye.